Thank you so much for joining me for my first Internet address of 2010. I hope you had a wonderful holiday season and restful as well. As the House and Senate leaders work to merge our two health care bills, there are 6 priorities that I'm focused on through this conference. And they've been some of the same priorities I've focused on since the beginning of this health care debate. One is reducing cost to the government and to individuals, and one way to do that is to place a tax, as unpopular as it might be, on the very expensive health care plans that the tax code is now subsidizing. I know this is controversial, but economists, both liberal and conservatives, believe that if we tax those plans so that we cannot continue just to write off, no matter how expensive private insurance is, that it will force employers to be more careful in the choices that they choose and will ultimately bring down the cost to the government while providing quality, affordable health care, and that's what we want. So I'm going to be looking very, very hard at that cost containment measure. Second is the elimination of the public option. I'm not eliminating affordability. I'm not eliminating access, but I want to eliminate any potential for a government takeover. This should be a private sector reform effort, and that's what we fought for in the Senate bill. The Senate bill sets up health care exchange models, different than the House, but I think on a state basis it's important, and makes good on the promise that at least there'll be one national insurance plan that provides private insurance just like members of Congress and federal employees have to all Americans. That is very important. The President promised to provide health care the same way members of Congress and federal employees have to all Americans. We meet that promise in the Senate bill. Third is assistance to small business. Many, many small businesses in Louisiana and across the nation are dropping coverage, not because they don't like their workers, not because they don't want to help their workers, but because they simply can't afford it. So a package of amendments that I offered along with Senator Lincoln and Senator Stabenow give more generous subsidies to small businesses, more tax breaks for small businesses that are businesses below 25 employees, and help them get access to these exchanges so they can have more choices, better choices at lower cost, and delay penalties associated with not having insurance for those businesses over 50 people, which would be very important. And finally, actually fourth, is assistance to foster care youth. One of the important things in the underlying bill is that all children actually up to the age of 26, which really is a young adult, graduating from college or through college, just getting out of college, if you're 26 years old and younger, you can stay connected to your parents' plans. That's one of the reforms, which is very, very important. Right now, when you're 21 or even 18 in some cases, you have to be kicked off of your parents' plan and go without coverage. So if we're going to do that for children with parents in America, I said we most certainly need to do it for the 20,000 children that don't have parents in America, and that's the kids that are in the foster care system. So under my amendment, children starting in 2014 that age out of the foster care system will be able to stay with their parents' care, which is Medicaid. The government basically are acting as their parents. We failed to get them adopted, which we should have done. We didn't, or get them reunited with their family. We're the only family they have. We need to give them coverage. So we're going to do that through Medicaid. It's a small cost in the scheme of things, but very important. Finally, the creation of a Medicare Advisory Board, an independent board that will make recommendations for how to best streamline Medicaid care and make it more cost-effective, extending the life of Medicare. We're very proud of this Medicare program. Our seniors, everyone 65 and older, generally likes it. They're comfortable with it. It's been something besides Social Security that's helped lift many of our seniors out of poverty and give them confidence in their later years that they will get quality health care. But we need to make sure that Medicare is strengthened over time, and that independent commission is very important. And finally, expanding Medicaid in a sustainable way. I support an increase of Medicaid up to 33% of the poverty level. So if you're making minimum wage in Louisiana, if you're working 40 hours a week at minimum wage, you're an individual, you make $14,000 a year, you will now have health insurance through Medicaid. If you're a family of four and you make $29,000, a family of four, you're working full-time, doing everything you can, fighting hard for your kids, you will be covered under Medicaid. The federal government will pick up a large portion of that. The state will pick up some. So in our attempt and conclusion to try to do health care reform for the country, try to get as many people covered through some expanding of public programs like Medicaid, but mostly by reforming the private insurance market. That's why this bill is important to people in Louisiana and across the nation. So let's hope we can compromise these big issues. These are the things that I'm going to be focused on through the next coming weeks. I thank you so much for your attention. Please contact our office to continue to give your input and feedback on this important reform effort for our state and our nation. Thank you for listening.